wanted to hop on here and talk about a patient I had. He was having some left-sided anterior hip pain, and he diagnosed himself with a possible labral tear. He thought it was happening deep within the joint, but he also noticed some soft tissue-like symptoms on the outside of the joint, and it was hard for him to differentiate between the two. But sometimes those issues can be connected, joint issues and soft tissue issues. If the soft tissue surrounding the joint doesn't have the optimal function, then the joint itself might be compromised, and you might hear things like clicking, popping. It's not necessarily a bad thing. However, it's a sign for us to investigate what's going on. Could be a release of pressure from the joint capsule, benign. It's like when you pop your spine. It could also be indicative of osteoarthritis. Could be indicative of tendon rubbing over a bone. So he presented with a hiked right pelvis and the left groin typically elongated. And if a muscle is too elongated, it might be hard to initiate contraction. Kind of like if you're going to do a bicep curl, it's easier to curl when you're in mid-range as opposed to end range. We have to remember that the hip is half the pelvis, half the femur, roughly speaking. And if we just manipulate the femoral position and we don't consider how the pelvis is positioned, then your hip joint is not going to move optimally.